I rise in strong support of LD 1639. I want to start by telling you a piece of my own personal story. I went to nursing school and received both my bachelor's and my master's as a single mom. I'm not unique in the world of nursing. The caregiving professions are full of people just like me who lean in to commitment of caring for others through dedication and hard work. 88% of nurses in the United States are female. In my short time here in the legislature, there are a few bills that I can relate to more personally than this one. I can remember with clarity the feeling of walking out of the hospital after a 14-hour shift with a deep and pervasive sense of dread that I'd forgotten to chart something about one of my patients. I remember shifts on the floor when my bladder was so full, but there was way too much to do, and my needs felt secondary to the call bells ringing. Mr. President, I can tell you with humility that being in the legislature is like a relaxing hobby in comparison to working as a bedside nurse. The fear of near misses and possibly devastating errors from working over capacity as a bedside nurse builds a sense of moral injury one shift at a time. Somehow, I failed to tell this reality to my own daughter. I did not communicate the deep and profound challenge of what it means to be a nurse. I encouraged her to sign up for nursing school, and I only shared the part of the story that matters. I only shared the message with her about the true joy and satisfaction that I felt about my work as a nurse. As a friend of mine once said, the work is both beautiful and relentless. The bill in front of you today accomplishes two primary goals: increasing patient safety and encouraging nurse retention. Not all of us are going to practice as nurses, but at some point in life, we're either going to be a patient or we're going to be the loved one of a patient. The care and touch of a nurse in the time when you are most vulnerable increases patient satisfaction, dignity, and the overall perception of a patient and family's hospital experience. This is a bill for everyone, but most especially, this is a bill for bedside nurses. The opposition will tell you that hospitals will close, go broke, never find enough nurses to fill necessary positions. They will talk about traveling nurses, they will ask for studies, and they will say, we are working really, really hard to achieve quality care goals. However, evidence shows that nurse recruitment and retention rates increase with staffing ratios. Nationally, there are 1 million licensed nurses who aren't working in nursing. Maine has approximately 28,000 nurses, and they're not all working in the field. Maine ranks higher than the national average in the number of licensed nurses per capita, and higher than both California and Oregon, where ratios are already in place. Maine does not have a shortage of nurses. We have workplace conditions that are unacceptable to nurses. In previous legislative sessions and in other states when this policy proposal has come up, the cry has always been to increase nurse education efforts. You'll be pleased, Mr. President, as pleased as I was, to learn that these efforts have paid off nationally. We've created a continuous, fresh pipeline of new graduates, but hospitals are churning right through them. I can't imagine that this was the intended outcome when the legislature chose to fund nursing education. This is just simply not about getting enough nurses to accomplish the work, Mr. President. It's about, as I said before, working conditions where nurses are not able to deliver quality care. So let's just talk about for a second what happens when you have too many patients to care for. Moral distress. When RNs make medication errors because of exhaustion, when they become liable for mistakes and malpractice, and when RNs don't have the tools they need to give safe care, it causes moral distress. Med errors, for example, are an easy and grave mistake to make. Systems and technology are in place to minimize those mistakes, but those fixes are no substitute for an attentive nurse. Right med, right dose, right route, right patient. That's the mantra for every nurse every time she gives a medication. And if you get it right, but you forget to record the activity because you're too busy, you forget to put it in the medical record, if you're challenged in a malpractice suit, your word doesn't matter, because if you didn't write it down, you didn't do it, and you're liable for the error, not the hospital. Nurses have lost their licenses for making mistakes that happen when they had too many patients to care for on a shift. Humans get tired. All of the nurses I know are up for the task. But when mental exhaustion is compounded by the moral quandaries of, did I miss something today? Did the next shift nurse get good notes from me? Could we have done more to save this patient? That is when we enter the territory of moral injury and stress. Mr. President, these are not grouchy workers in a bad career. These are dedicated caregivers. And as a nurse myself, it's in our DNA to care and to comfort, and to use a word often heard in these halls, to serve. Nurses who push onward in unsafe nurse-patient ratios on a daily basis do suffer. These are veterans. They're tough as any military vet, and they will not let their patients see their suffering. But as hospitals build slick new wings, administrators' pay skyrockets, and the gender pay gap remains stubbornly lodged in an earlier era, this is not a labor model with a future. My daughter and her nursing friends are the future of care in Maine, and they will not sacrifice themselves. Will they serve? Absolutely. How convenient to continually target a nursing shortage as the reason for staffing issues, rather than admit that you might need to adjust the workplace conditions to retain new graduate nurses who enter your facility. If we can't find enough nurses in the current conditions, let's change those conditions so nurses will come back to the bedside. And then what about the patients? What about patient outcomes? There's compelling data about the effectiveness of nurse-patient ratios. 30-plus years of research show patient outcome data revealing shorter hospital stays, lower infection rates. Studies show that when registered nurses are forced to care for too many patients at one time, there are medical errors, complications, falls and injuries, pressure sores, increased lengths of stay, readmissions, and death. Studies prove this, but nurses know it. Nurses experience moral distress because of it. They know the way to provide safe and effective care to our patients is to mandate minimum safe staffing levels through this legislation. Many nurses are not going to share their story in front of management in a public hearing, but they have come forward to ask for the legislature's help because they have nowhere else to turn. Mr. President, nurses are the most trusted profession in the country. All of us will experience the care of a nurse in the coming years. They are both the face of health care for the patient and the eyes and the ears for doctors. So when you are next in the hospital and you wake up from surgery and your nurse is there to reassure you, and when your nurse is there to fill you in on how the night went for your loved one in the ICU, and when your wife finally feels like she needs to push after a long labor and your nurse shows up and says, "Let's do this, I can't wait to meet this baby," and your 89-year-old father-in-law rings your nurse because he finally has to have a bowel movement and he needs help getting to the commode so he can preserve his dignity, and when your nurse is there to tell you that she's so sorry for your loss, or when she doesn't come at all when you ring the bell because she's really busy down the hall with all the other patients. I just want you to reflect for a minute, Mr. President, on how many times your nurse has reached into the deep well of her heart for you and your family. And then I want you to remember how many times she did that day, that month, that week, for all of Mainers. This is a bill for the bedside nurses. I urge you to support the pending motion. Thank you.
22 senators have voted in the affirmative and 13 have voted in the negative. The motion ought to pass as amended prevails.